Welcome to this month's in-service on Documentation Part 1. In this PowerPoint, we will go over the importance of documenting, why it's important to document, and then go over some of the more common forms that are used at CHDC. Residential records, medical records, and central records all contain information on each individual. These are all permanent legal records. These records contain physician's orders, health information, health history, social history, CNA notes, 24-hour schedule, individual program plans, progress notes, and other pertinent information concerning the individual. These records provide an accurate picture of the individual. We should only be using CHDC-approved forms. These records assist in maintaining ongoing care and progress of individuals residing at CHDC. These are covered under HIPAA and considered confidential, so they should always be secured and remain on CHDC grounds. Rules for documenting. All entries must be printed legibly in black or blue ink. Every entry must be signed with full name and full title. All entries must be in chronological order. Entries must be exact, brief, and complete. Erasers and whiteouts are not allowed. There should not be any blank spaces. For example, use NA if it does not apply. Use only approved abbreviations. Ditto marks are not allowed. Every sheet of paper in the record must be properly identified with a name. It's important to take the documentation piece very seriously. These are legal documents and are reviewed by our physicians, nurses, psych examiners, surveyors, and other committees. So take the time that is needed to fill out the documentation to ensure that we are accurately describing what our individuals do each day. All documentation should be completed daily. Review the daily logbook for changes at the beginning of your shift. This helps ensure that you know if there have been any changes with your individuals or change in the care you provide. CNA notes are entries made in the residence record in the living unit. These entries may cover care and treatment provided to each individual, the individual's response or lack of response to care and treatment, how the individual looks, reacts, and interacts, the measures taken to protect the safety of the individual. So entries in the logbook should never include staff's opinions, become a vehicle for personal complaints, or discuss staff conflicts. The information in the logbook is for individual information only and should always be objective concerning the progress or conditions. Be sure to use your communication book for any other concerns you may have pertaining to your shift. These are some documenting reminders. We always need to make sure that our entries are objective. These are based on facts, and some of the examples would be like Jack weighs 175 pounds. We can verify that. Or Jill drank 3 ounces of Kool-Aid. Jana did not eat her lunch. The other type of documenting entries that we don't allow are things that are subjective. So when you include your own conclusions, impressions, or assumptions, those things are not allowed or appropriate for documenting in the individual records. So for example, Jack weighs too much, or Jill doesn't drink enough water, or Jana didn't like her lunch. These are all personal opinions. This means you are to chart only what actually occurred. You are ultimately responsible for the accuracy of the entries you make. So for this month's in-service, we're just going to look at a few forms that are commonly used across CHDC. Some of those forms we're going to look at is the observation and fall report, the marks report, injury report and review, the body audit, behavior report, seizure report, and the residential care notes, which is also known as the CNA notes. There's going to be more forms that will be discussed in the next section for the documentation. So the first report we're going to look at is called the observation report. This is used to report any behavior that is out of the ordinary or unusual and is not considered as typical behavior for the individual. So for example, any physical changes, eating changes, sleep changes, response changes, etc. If a resident falls, complete both an observation report and the fall report. The fall report is located on the back side of the observation report form. Note that on the observation form, there are some items that have an asterisk beside them. If any of these apply to the observation, they are to be communicated to the nurse immediately. For example, if an individual has vomited after eating, document it under the Eating Changes section. You need to document how much and how long after eating or drinking did this begin. If it did not occur after meals, document the vomiting under the section of Physical Changes and specify any details that apply under it. If there are any refusals observed during mealtime, be sure that you have offered an alternative before documenting a refusal. Once the documentation is completed, give the report to the nurse as soon as possible. As said earlier, the fall report is located on the back side of the observation report and is to be filled out anytime an individual has a fall. It's important to make sure all of the information has been provided and it's accurate. Whether it was witnessed or not, you still need to gather as much information as possible from the individual and also from any staff that might have been in the area during the time of the fall. Based on what you have documented, this form is reviewed by team and helps the team determine what actions or steps need to be taken next to help reduce or avoid any further falls. The next report is called the Marks Report. This is to be completed anytime a mark or abnormal finding is observed on the skin, whether witnessed or not. This includes bruises, scratches, red areas, marks, and suspicious areas of the skin appearance that might be a symptom of illness, rash, or other physical conditions. The best times to do an inspection on an individual's skin is during bathing. Please look them over and make sure there are no new areas of concern that need to be documented. Be sure to use the figures for reference as to the location of the mark. If there was a behavior associated with the Marks report, remember to fill out a behavior report. For example, 2 of the residents get into an argument and one decides to bite the other one. You will fill out a behavior report and a Marks report. If an injury is noted, staff are to conduct an informal investigation as to the source of the injury or a probable source of the injury. There are no unknown causes. If we cannot verify the source of the injury, there will be an investigation as to the reason for the injury. This is a triplet form. The white copy will go to the medical records, the pink copy will go to the team nurse, and the yellow copy will go to the residents. So be sure to press down firmly so that all forms are legible. Every position is responsible to do their part to make sure our individuals are examined in the event of an injury or illness. If it is not cleared up completely, it will need to be rechecked. So an additional Marks report may be required. Be sure to follow the steps once you have noticed a new mark or injury to the skin. You will notify the nurse, fill out the Marks card and a blue injury report. Be sure to give the Marks card to the nurse and add the findings in the logbook. Call your team office so they can fill out the injury logbook. Be sure you document your findings in the resident injury logbook. The nurse will assess the reported mark or lesion. If treatment is needed, they'll write an MD note. The living unit nurse will receive the orders, then transcribe the order and add to the CNA treatment sheet if needed. The nurse will write directions in the living unit logbook. Information regarding any injuries are to be related to the nurse as soon as possible. If a serious injury is discovered during evenings or nights, you will need to notify the infirmary. We're now going to look at the injury report and review report. This form is typically initiated by the ROM on first shift and by the shift supervisor or designee on second and third shifts. The ROM may direct residential care staff to initiate the form in Section 1 for an injury or mark of known origin. Section 1 is completed for any injury or mark in addition to a Marks report and entry on the injury reporting log. Section 1A is completed for any injury or mark of unknown source or requiring a physician's attention. Section 2 is for notification and it's completed by the ROM or the designee. Section 3 is completed if the cause is unknown by ROM or designee. Section 4 may be completed by the ROM or shift supervisor or designee. Section 5 is completed by the QASC or designee. The ROM reviews and signs the form. The next form is called the body audit. This is completed on a resident before leaving and upon returning from home visits, hospital stays, or long stays away from CHDC. Body audits are important pieces of documentation that help establish new or old marks on an individual's body when they are on or off grounds. Before an individual leaves CHDC, it's important to inspect the individual from head to toe and document any existing marks or other skin injuries and record that on the body audit form. Use the figures to the left of the form to show where the affected area is located. Describe the noted area with as much information as possible. Sign your name and title after inspection is completed. Upon return, you will follow the same process immediately, inspecting the individual from head to toe. If there are any new injuries to the body, use the figures to the left, marking the area affected. If there is any concern about a mark or skin injury that happened while the individual was away from CHDC, this documentation will serve as a form of reference. By doing this, you are protecting your individuals and protecting yourself. The next report is called the Behavior Report. It's completed any time an individual has an aggressive behavior that is dangerous to others, self-injurious, or destructive to property. Please complete as many boxes that apply to each situation from each group of the Behavior Report. Under Other Behavior, please mark all that apply. All marked boxes are recorded. For tracking purposes, these boxes must be marked. If the person disrobed, be sure that box is marked in this section. If they stole an item, check that box and list what was stolen in the line provided, such as drink, food, shoes, etc. If their behavior is not listed, write a 1 to 2 word description on the line by other, such as grabbing or flipping furniture, etc. It's important to document all behaviors when they happen. These reports go through a review process each time they occur and will determine if the individual needs a medication change or new medication. They may also help with determining if the individual needs nursing intervention. These reports also help in determining if they need supervision or a preventative containment. This is a triplet form. The white copy goes to central records, the yellow copy goes to psych examiners, and the pink copy will go out to the residents. When you are filling out this report, be sure to press down firmly so that all of the forms are legible. Please make sure they understand that they need to fill out a behavior report for all aggression, even if they don't think it's dangerous. For instance, pushing another resident is aggressive, but usually not dangerous. This next form is called the story of what happened. This is not anything that is tracked. It's just used if you need additional space after filling out a behavior report. Once it's filled out, you'll attach it to the back of the behavior report and then place it in the designated area established by your ROM or the designee. This will be reviewed by your team psych examiner and the QASC. So there's different boxes there that will ask you to describe what happened. So if you need more room to describe that, you have this sheet. How was the problem resolved? You can add additional information there. You can also talk about what started the problem, and then share anything else about this that you may think your psych examiner needs to know. The next one is called the seizure report. A seizure report is to be completed by the person who observed the seizure. A seizure report will be completed on each individual that has a seizure or according to the physician APRN instructions. The seizure report is to be completed by the person who observed that seizure activity. Each section should be responded to appropriately with comments providing pertinent information for the medical staff. Complete the name, residence, date, and time, as well as other boxes that are appropriate. In the comments section, describe what you observed the person doing and how long it lasted. The medical use only section is completed by the nurse. If a vagal nerve stimulator was used, make sure that you document that and how many times it was used. The seizure report will be sent immediately to clinic. A physician or APRN will review the seizure report and ensure that copies are routed to medical records for filing under the tab for seizures. The team nurse will review the seizure report and the residential copy will be filed in with the medical nursing progress notes and orders section of the individual's residential file. And the last form is called the Residential Care Notes. This is something you may recognize as the CNA notes. This is to be completed on a weekly basis at the minimum. This is to provide additional information about the individual. This form is looked at by the team on a regular basis. That concludes our presentation for the documentation part 1 piece. Thank you all for your attention. If you have any questions, feel free to call staff development at extension 267. Also be sure to take the 2-question test and then turn into your residential supervisor once that's completed. Thank you and have a great day.